Hillarie, how are you?
I'm doing good. How are you doing today, Matt?
I'm doing well. I actually have a coffee. I got to meet somebody for coffee after this, which I always get excited about. There's no part of the day when I don't want more coffee.
I really feel you there.
Yeah. Listen, you work for an organization that focuses on Idaho children and Idaho families. And you and I got connected because the Medicaid reform bill that's going through, I've spoken with several people about it, and recently I had a Representative Furman on. He was great. Had him on yesterday. I think that published today. But I've spoken to many people about the Medicaid bill, and on the face of the reform bill, it seems very reasonable in that they're like, hey, look, man, you shouldn't be getting Medicaid if you don't have a job. Like, let's put a job requirement. And it's like, okay, like, that's fine. I don't know anything about it. Cool. And then they're like, well, there are some just things that, again, people just saying, hey, these are reasonable things that we should have. And if we don't get this, then we want to remove it. And it's like, okay, look, I don't know anything about it. But as things started coming, more details about the requirements that Idaho is putting on in this reform bill, I started realizing, as some people, they're like, it's not a reform bill, it's a repeal bill. And I'm like, well, how is that? And I'm like, because the things they're reforming it to are impossible. And that's what I wanted to understand more about. Now, again, whether or not people want the Medicaid in Idaho at all, it's not my affair, right? I just want to understand this bill and the implications and what is actually happening more.
Yeah, Matt. So you're absolutely right. It's the Medicaid bill, House Bill 138. Everybody calls it reform, but really it's reform and repeal clothing. Or repeal and reform clothing. Medicaid expansion repeal is going to happen if this bill passes. And a lot of it is because we have 11 conditions that this bill requires that the state do, or Medicaid expansion is going to be repealed. And when you look at all of the conditions that are laid out in the bill, there's 11 of them. Essentially, this bill says, hey, Idaho, I'm giving you 11 tests. And if you fail one of them, we're scrapping the whole program.
And if I may ask, to confirm, some of these tests are dependent on other states or the federal government doing things. So it's not even like, hey, Idaho, you have to successfully meet these conditions. Like, if you were talking to me, it's like, okay, what do I need to do? Well, what you need to do is get a federal judge in a different state to overturn his ruling on something. It's like, wait, excuse me? And they're like, yeah, that guy ruled over there in that other state on the East Coast on this particular matter. And in order for you to maintain Medicaid, you have to go meet him in his chambers and be like, Your Honor, please overturn. And he'd be like, yeah, no, I'm not doing that. So it's not even things that we have to particularly do. It's that the world itself needs to be different.
Yeah, so let's walk through some of these different waivers that the bill requires. So there are 11 conditions, and several of them, actually, I think 10 out of 11 require the state to submit what's called a waiver. And it's essentially an application to the Fed saying, we want to deviate from our current program, and we need your permission to do it. And so you have to submit a waiver, that's called a waiver, and you have to get the Center for Medicaid and Medicare Services to say, hey, we would like to do a work requirement. We would like to do an enrollment cap and a lifetime limit. Oh, and we also want to allow people to go on the health insurance exchange and choose between Medicaid and purchasing health insurance through the marketplace. Oh, and we also want to make sure that the Department of Health and Welfare is meeting certain administrative requirements. Sure. So you're asking all these different things to happen and be changed. Well, the issue with some of these waivers that are getting submitted is several of them have been rejected previously in the Trump administration when he was president last time. So we're asking the federal government to approve waivers and approve new rules for Medicaid expansion that haven't ever been approved before. And like you said, they've been held up in federal court. Even some of the ones like work requirements that have been approved at the federal level, they've ended up in court. And federal courts have said this doesn't align with Medicaid law, which is Medicaid law is to provide health insurance to those who need it and who qualify.
And if I may, a quick question on this. Somebody articulated this really well to me the other day. They're like, look, the purpose of Medicaid is not to provide a service or provide medical insurance for people who are diligently trying to go to work and better their lives through volunteerism or education or employment. The point of Medicaid is to provide medical insurance for somebody who doesn't have medical insurance. That's it. And that's somebody who's going to school, volunteering, working, or not, because there's a benefit to people having insurance. There's a benefit to that in person, but also to the state, right? If people have medical insurance, they're more likely to engage in preventative care. They're more likely to go see doctors before things get out of control. And in the event of some catastrophic, horrible accident, God forbid, they will have medical coverage so that we, the state, don't pick these things up. If you don't have preventative care and you don't engage in going to see a doctor regularly, then smaller things can spin out of control and become these astronomical expenses that you likely would not have the money to pay for. And then the state and the populace would pick up that tab. So it's like, look, it's in all of our financial best interest that as many people have coverage as possible, whoever they may be. Because if you don't have a job, you still could get in a car accident. You don't have a job, you could still get appendicitis and need to get, an appendectomy. Like if you don't have coverage or a job and you go and have all of these things happen, it's, again, financially, we're on the hook. Like aside from whatever moral obligation that some people argue that we have, it's like, okay, if I just care about money, it's far better for people that don't have insurance, for me as a taxpayer, to get them with insurance, regardless of what they're doing with their lives. Is that
you're
the correct
you're
position?
100% correct. And so to that point, I want to go back to why we have Medicaid expansion in the first place. So for several years, all the way up until about 2020, Idaho had what was called a health coverage gap. You had individuals in the state that fell into a certain income range. These are working Idahoans in low-wage jobs. Their parents, they were caregivers. They did not have a health insurance option through their work, and they were considered a low-income household. They did not make enough to qualify for a tax credit on the state-based marketplace, but they also made too much to qualify for traditional Medicaid, which before Medicaid expansion, to qualify for Medicaid, you basically had to be a parent with a child living in your home under the age of 18, and you couldn't make more than 26% of the federal poverty line. It's like a couple $100 a month. You're basically destitute in the state, or you're homeless if you're going to fall into that income range. So you had about 72,000 people or adults in the state who fell into this gap where they didn't have anything unless they wanted to go and spend the thousands of dollars to purchase a marketplace plan because they didn't get a tax credit. But when you're that low income, and just for context, for a family of 4 to qualify for Medicaid expansion, for the adults, for the parents to qualify, you can't make more than about $3,500 a month. And that's gross income.
So that's household income, like between the two people.
Household income, correct.
Great. So you're making $42,000 a year as a family.
Yes, as a family of 4. And when you start looking at what that translates to, you look at cost of living in Idaho on an average basis for groceries, rent, electricity, you have a couple $100 left over a month. You're not going to have the funds to go purchase health insurance. You're trying to figure out how to pay gas to get to work. Anyway, so you have this gap of Idahoans, about 72,000 Idahoans who were uninsured for several years. And the legislature really looked at this for several years, but failed again and again to solve this problem. And so it ended up in the hands of voters as a ballot initiative in 2018. And 61% came out and voted in favor of Medicaid expansion because they saw the value of exactly what you just said. We're paying for it one way or another through uncompensated care. When people are uninsured, they're not going to the doctor. They are not getting that preventative care. And we're paying for it in one way or another. And so we passed Medicaid expansion. In 2020, it was implemented, and the coverage gap was closed. And we had about 70,000 people who were newly insured.
Okay. And since then, the 70 has actually increased to roughly 90,000 people, correct?
Yeah. So right now, enrollment fluctuates on a monthly basis. At the end of 2024, there were about 85,000 Idahoans on the program, which is actually a lot less than was originally projected. Pre-Medicaid expansion, a lot of actuarial analysis looked at projected costs and projected enrollment, and they anticipated about 115,000 would be on about right now. So we're actually quite a bit lower than was projected. But on on an average basis right now, we're about 85, 90,000 enrolled in the program.
Gotcha. Okay. So what are the aspects of this bill that make it actually a repeal bill instead of the reform? So the waiver programs, again, there are several things, like the work requirement, I believe, was a waiver that was applied for in 2019 under the Trump administration that was rejected by the Trump administration. So although some people have said, well, now that we have a favorable president, there's what some people think. They're like, now that we have a favorable president, we'll get this passed. It's like, no. The Trump administration in 2019 already rejected this, right?
So the work requirement waiver. So you're right. In 2019, there was a bill that passed that put a work requirement on Medicaid expansion. That actually never got approved during the Trump administration because by the time the Biden administration came in, they said, we don't want to approve these. These keep getting held up in federal court, and they don't meet Medicaid objectives, which is regardless to provide health insurance.
Okay, so my apology. I didn't mean to interrupt. No. So regardless of what the administration is saying, they're like, hey, look, even if we say yes, it'll get held up in federal court, and get shot down anyway. So like, why are we going to approve this and give them essentially engage in this thing where it's like, it's not getting approved by the courts?
Right. And so the work requirement, we still have a work requirement technically on the Idaho books. So when you look in Idaho code, we have a work requirement on Medicaid expansion. That waiver is sitting with the feds right now. It's still pending, and the Trump administration could come in and approve it if they wanted to. However, there are other waivers. So that's one waiver that I know a lot of lawmakers are really interested in looking at getting approved. But I think it's important to note we have one in statute. We don't need to pass another bill to put another one in statute. And we already have a waiver sitting at CMS. However, when they have been approved under the Trump administration, they ended up in federal court. And so there's a lot of uncertainty about where that waiver goes if it gets approved. But that's not the only one in these 11 conditions that I think are the most concerning. There was a waiver that we did also apply for in 2019. Idaho applied for, and it's the Medicaid or the Marketplace Choice Plan. So it's giving people a choice between, hey, I want Medicaid or I want to go on the exchange and get a tax credit. We applied for that waiver as a part of that same bill. And the Trump administration said, no, we're not going to grant you this waiver because it's going to cost the federal government more to cover these people on the exchange than it would be to cover through Medicaid.
Okay. So work requirement, the application's already in. It's been in forever. The Trump administration could approve it at the drop of a hat. So that's already there. The Medicaid or private exchange tax credit was rejected by the Trump administration already.
Yes.
So we don't have any new information to suspect like, oh, we would have a more favorable outcome at this point.
Correct. There is nothing to say that when you read the language in House Bill 138 and compare it to the bill that passed in 2019, the language is the exact same. It would be the same waiver that would have to be submitted. And there's nothing to show that they would have any more reason to approve it now as opposed to then. And when you look at the other waivers, there's the enrollment cap and a lifetime limit. Both Arizona and Utah submitted these same waivers under the Trump administration, and the Trump administration rejected them then. And so, there's a reason why a lot of these got rejected even under the Trump administration. Waivers that they have to apply for have very specific rules that have to be followed. These are in federal regulations. You have to meet certain criteria for us to say, yes, we'll grant you this waiver. These waivers are called demonstration waivers, and they have to demonstrate how they are expanding coverage to new populations or expanding past what current Medicaid covers. And when you look at an enrollment cap or a lifetime limit, they explicitly reduce the number of people who would otherwise be eligible for Medicaid. And so they completely go against the rules for those waivers. And this is why even in the Trump administration, they couldn't approve them.
Gotcha, because they're inherently constrictive. They're like, listen, we're going to do this and this will take people off Medicaid. It's like, that's the exact opposite of what you're allowed to do.
Exactly. And so when you look at this bill from a whole, essentially, the state is we're tying our hands as a state. We're saying, okay, feds, we're going to put Medicaid expansion in your hands, and we're going to ask you to approve all these waivers, even though there's nothing to show that gives us faith that you're going to do it. Even if the Trump administration comes in and says, oh, we want to be innovative, we want to be creative, and we want to approve these types of things. One, they don't meet the rules. It's really hard for them to. They're going to get held up in federal court if they even do get approved. And so we're putting so much at stake by saying we're going to repeal expansion in a year. So let's also just remember the bill says the state has until next July to get these waivers submitted and approved by the feds and implemented at the state level, or expansion is repealed. And so we're saying we have a little over a year for all of these things to happen. You have to go through federal and state public comment periods. So there are timelines and boxes you have to check along the way that take time. And these type of complicated waivers take anywhere from 12 plus months to actually go through the whole process to get approved. And so we're essentially putting Medicaid expansion repeal on autopilot to go off in a year and a year and a half or so, and handing over all of our state authority to the feds and saying, hey, we're putting Medicaid expansion in your hands, and tying ours, because if the feds just basically handing everything over to the feds.
If I may, what are other waivers? Because there was as my understanding, there was one waiver that said, hey, unless you get every federal court that has ruled that transgender medications, and I'm not 100% sure about all this, but it was a ruling regarding transgender individuals getting Medicaid dollars. Unless that gets turned over, then Medicaid, then we repeal our Medicaid expansion. And again, that one is dependent literally on us going to judges, right? And going to other states and saying, hey, you have to overturn this thing. Like, it's not even in the federal government's hands. It's like, no, these individual people in these individual states have to collectively overturn what they already thought, and which we have no reason to suspect they would. Whether or not you wanted to, it's like, listen, this is not a mechanism that we really have any effect over. What are other things? So we have the, private insurance, we have the work requirement, we have the, hey, get the judges in other states to overturn their opinions on whether or not transgender people should have access to Medicaid. What else?
There was another one that was barring Medicaid from going to providers if they provide any sort of gender affirming care in the state to minors. That one is likely illegal, even though we actually have an Idaho code where providing any sort of gender affirming care to minors is already illegal. Right. So did
they just add that in there as like commentary?
I honestly don't know exactly why that one is in there, to be honest with you. And
they would be like banning abortions. It's like abortions are already banned.
Essentially.
Or elective termination.
Essentially. Right? And so that one, a couple of them just don't really actually make sense in how they apply to Medicaid expansion. And so you want to bar Medicaid from going to providers that provide gender affirming care to minors. Okay, well, that's not Medicaid expansion. And then you also have administrative requirements in this bill that have nothing to do with Medicaid expansion. There's this provision in there called the perm rate cap. And so essentially what it is, it's a payment error rate measurement is what it's called. And this is to try not to get too into the weeds on it, which is kind of hard not to. Essentially, it is looking at what are some administrative errors happening in the state that are wrong, basically. They think that a lot of legislators think this is like a calculation of fraud, and it's not. Essentially, it's saying, oh, well, we have this administrative code getting thrown because billing got coded wrong, or a provider entered in something incorrectly and got billed for the wrong service. And so it's basically administrative errors from the provider side and from the state agency side. And essentially they're trying to say, well, we want to keep those error rate to a high level of 5%. There's no state that does that, and it's likely not even legal to implement a policy saying, oh, well, you need to keep your perm rate at 5% or we're going to take Medicaid expansion away. So it's saying...
What are normal perm rates in different states?
So when you look at the national average, It's calculated every 3 years, which is by a federal contractor.
Okay.
And so when you look at the national average, I think in 2019, it was around 18%. So it may seem high, but they're literally just error codes that happen from the state agency maybe not implementing a federal policy correctly, or they're not coding different populations to the correct match rate correctly, or providers are not actually billing correctly for certain services. So when you
there are a lot of reasons why the 18%
exactly
exists,
and
but
Idaho
the 18% is not. It's not like, hey, we want you to be 17%. Like, we want you to do a little bit better than average.
Right.
Like, we want you to be at a level that is in practice likely impossible to do, just understanding the system we're engaged in.
Right. And what's interesting is last legislative session, this came up because it was a part of the same bill last year. And the state came and said, ours is around 2%. We've corrected a lot. And when we do internal reviews, it's about 2%. And so it's an arbitrary number that it's just based on a 3-year average. And we're essentially saying, Department of Health and Welfare, you need to meet this rule, or the consequences, we're going to take coverage away from people. So if you're a family over here and you're relying on expansion, and suddenly the department happens to go over that 5%, okay, well, now we're going to take Medicaid away from these parents over here.
Yeah, that's another aspect of this where it's like, wait, this is completely out of my control, right? Just like the federal courts in other states, like, this is completely out of my control. And why is that? Why does the burden of that get laid on the Idaho citizen?
Correct. And I mean, when you look at these 11 conditions, only a couple of them actually refer to the Medicaid expansion individual. The rest are looking at administrative changes. One of them was reducing changing the way renewals are happening at the state level, how you look at income, how you fill out paperwork at the department. So there's different requirements in there saying, we want you to do this. There's also just removing efficiencies that have been in place for years that no other state has done. One of them is presumptive eligibility. That was an element of the bill. Looking at, so if you go to the hospital and you're uninsured, the hospital has the ability to say, well, why are you uninsured? Let's look at your income. Maybe you qualify for some assistance. And you can sit there and say, okay, well, this is my income. They'll go and they'll look against Medicaid eligibility and say, oh, well, you actually qualify for Medicaid. So we're going to...
Without going through like a check your income tax stuff, because you're at the hospital.
You're at the hospital.
You've got a broken arm. You're like, I only make $35,000 a year. And they're like, okay, well, that may actually qualify you for this.
Correct. And so they sign you up. They consider you presumptively eligible based on what you say. And you get Medicaid from, so let's say you went into the hospital tomorrow and you didn't have health insurance. And they're like, oh, well, you are a single adult who is working a server job. You make $15,000 a year. You qualify for Medicaid. So we're going to sign you up. You get Medicaid through the end of February and then the end of March. But if you want to continue, you need to go and apply at Health and Welfare and give them your income information. And if you happen to go to the department and apply and find out that, oh, actually I wasn't eligible during that time, they don't pay. And so what this bill does, one of the provisions is we want to make it so only women who are pregnant and children have the ability to do that. We want to take it away from anybody else who goes to the hospital.
Why them?
It's a good question.
I mean, like, I'm not against moms and kids. I'm just saying, like, if the purpose of Medicaid is to insure uninsured people for a slew of reasons that are beneficial to the general populace, including financial savings, because the Medicaid expansion is a net savings for us, right?
Correct. Yes, Medicaid expansion has created a lot of savings for the state, and this is why this bill just doesn't make sense for Idaho, and nobody in Idaho is asking for this bill. This bill was not pushed by any Idaho organization, any specific entity in Idaho. This is really being pushed by outside or groups out of basically Florida, who are going around to different states and pushing these type of policies in states like Idaho to fundamentally change our program when they don't even really fully have a stake in what happens here because they're
Well,
not
if you're
even
in
from
Florida,
here.
you don't have any stake in Idaho. Okay, wait, who are the groups?
So Foundation for Government Accountability is one of the groups that has pushed this. They were here in 2019. They were the proponents behind the work requirement bill in 2019. Last legislative session, when this bill first came up, they came and gave a 45-minute presentation on Medicaid and this bill and what this bill would do for Idaho. And the lobbyist who came into the state and gave this big presentation wasn't even from here. And he was talking about Idaho in a way and Medicaid that wasn't even correct. And so...
Who was he presenting the 45 minutes to?
The House Health and Welfare Committee during the last testimony.
I'm actually testifying today. How much time do I get? 45 too? I'm testifying to the
You get
Senate
2 minutes, usually. 2 or 3 minutes.
How do I get the 45? Because I can spin a long yarn. I would love a 45-minute. Like, how does that work? Do you have to apply for that or something? Or does it just have to be granted by the, chairman or woman?
It usually is just left up to the bill sponsor and the chairman of the committee.
Wow. God bless it. I got to talk to somebody today.
Yeah,
I want 45 minutes. How much time did you get?
2 minutes.
Why didn't you call the sponsor and be like, hey, hook it up with 45? There needs to be a mechanism where I could just go off on the committee for no particular reason, just blah, 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 blah.
Yeah, it is a little challenging to get up there. And I mean, we're talking for a while about all the different reasons why this bill is not going to work. And I mean, I've been rambling for 20 plus minutes and I had to put all of that in 2 minutes. And so it's a challenge for sure. But essentially what's really...
Can I tell you something real fast?
Yeah.
My wife, who's always interested in the things I'm doing, but obviously doesn't have time to I'm doing 4 to 6 interviews a day. She doesn't have time to consume hours worth of content.
Right.
So she'll say something like, how did the Medicaid interview go today? I was like, oh yeah, I talked to this gal, Hillarie. It was great. She's like, what'd she say? And we're in the midst of trying to serve dinner. And I have 30 seconds of I can't, I don't even know where to start. And she's like, well, just tell me some of it. I'm like, okay, so there's the judge somewhere. Where's the judge? I don't know. The judge is not in Idaho. It's you can't break it. Just I'm sympathetic to your plight. It's impossible to explain. We've been talking, you've been educating me. It's not like you've been repeating yourself. You've just been saying stuff that takes a while to say.
And, I think it's important to know that Medicaid is complex. Yes. There's been a lot going on in Idaho over the last 5 years. I mean, COVID aside, we've had high levels of inflation. We've had incredible population growth. There's a lot of factors contributing to what's happening in Idaho. Medicaid has experienced a lot of that as well. It's experienced the growth and inflation, high healthcare costs, and yet Medicaid expansion has still been shown to be a really good deal for the state. So when you look at it from the financial perspective, as you were saying, we are creating a lot of state savings of programs that we were paying for originally. So before Medicaid expansion, we had a lot of funds going to catastrophic care funds to cover the uncompensated care, county indigent funds that was covered by property tax dollars. We had a behavioral health system that was completely fragmented, where there was no system of care if you had any sort of mental illness in the state. And we were paying for these programs in very patchwork ways with 100% state taxpayer dollars. And so with Medicaid expansion, we're able to cover all these areas and plus additionally tens of thousands of more Idahoans. So we were covering more people at essentially the same cost of what we were paying before, getting a better benefit because we have fewer uninsured people. We have fewer people showing up at the ER with uncompensated care. And we're also able to pull down federal funds to help cover it. So we have about $1 billion coming into the state on an annual basis that in turn provides a lot of economic benefit. When you look at the number of jobs created for Medicaid expansion alone, it produces about 9,300 jobs annually. And so you also look at the tax revenue that comes in. So people who are working in a job and have a job because we have Medicaid expansion, they're buying houses, they are spending money in their communities. That has resulted in about $47 million in tax revenue coming into the state. So when you look at the big picture of we're saving dollars on all these programs, we're covering more people, we're pulling down tax revenue, Medicaid expansion is a good financial deal for the state, not to mention the impact on everyday Idahoans.
Right. Sticking on the financial aspect a little bit, do you know how much like the indigent funds and the catastrophic care funds that were all 100% taxpayer, Idaho taxpayer fund, do you know how much all of that added up to, as well as the economic benefit we get from having, the 90, I think you said 5,000 jobs or something like that? Do you know how much all that adds up to?
So for every year that we have actual hard fiscal analysis, our savings have been greater than the cost of expansion. And so when you look at the last full year of data that we are able to analyze was fiscal year 23, it was about $78 million in savings that we were actually saving from state general fund dollars, and Medicaid expansion was about $73 million.
Gotcha. And then the savings is not even taking into account the economic benefit, correct?
Yeah. So that's not even taking into account all the economic benefit, all the tax revenue coming into the state, and all of that, the economic activity that comes from that.
Right. Because I have to assume when you insert $900 million of federal tax dollars, right, that come into the state to fund hospitals, nurses, doctors, things like that, again, that ripple effect has to be substantial within the economy.
Definitely. And I think that it's really important to note that when you look across the state, this is largely supported by so many people. The Idaho Falls Chamber of Commerce just put out a letter saying that they oppose this bill. And when you look at it from the financial perspective, they understand Idahoans around the state, organizations, healthcare providers, most people actually see that value. They know that it provides an economic value. It helps save money. It reduces health insurance costs for everybody, because if you have a lot of people going to the ER, hospitals have to and providers have to make that up somewhere. So they're going to raise their healthcare costs, and that gets shifted over to health insurance, private health insurance. So we're going to pay for it in higher health insurance premiums, or we're going to pay for it now in a better way with preventative care and a smaller uninsured population. So
yeah, listen, I appreciate every second of this. Yeah. And again, if people in the state of Idaho don't want this, that's fine. And if people in the state of Idaho do want it, that's fine too. But I'm just really happy that I finally have my head wrapped around. Okay.
Yeah, I do want to.
This is what this bill is.
Yeah. I want to mention a couple of things just super quick before we wrap up.
No, good.
We did a poll in 2023 to get a sense on where Idaho voters were, because we knew that costs have gone up in every industry, not just Medicaid.
Sure.
Costs were higher. And we wanted to really understand, do voters still support Medicaid expansion? And we found that voters' support for expansion has only grown since it passed in 2018. Even when we polled them on the cost, how many people were covered, and all of those different aspects of Medicaid expansion. And we found that 73% of Idaho voters do not support repealing Medicaid expansion. They support keeping it because they see the value it's providing and the fact that voters passed the bill. So
yeah,
Idaho voters are not asking for this. And this bill is going to tie our hands. And we're basically putting Medicaid expansion in the hands of federal bureaucrats and saying, federal bureaucrats, do you care about Idaho and whether or not we keep Medicaid expansion? Please pass these waivers or we're going to repeal it. And so it's like we're trying to threaten the federal government to pass these waivers or we're going to repeal Medicaid expansion. And the federal government's not going to lose out. Idaho's going to lose out.
Hillarie, I really appreciate you. Thank you for coming and explaining this. It sounds like your organization is far more educated than I am. So please come back. Let's talk about more issues.
Happy to come back. Thanks for having me.
Thank you.